Okay, so here I have the right insert Cavitron tip. You can tell because if you were to set it along a flat surface, here with my left one, you want the tip to be touching the surface that it's against. And since it's angling out towards the right, that means that it's gonna be our right one. So for this, when trying to figure out how to adapt your left and right, you need to go off of the back of your Cavitron tip. So you want the back of your tip when going along the buckle or the lingual surfaces to be up against the tooth. So for this right one, it would work on your lower right buccal surfaces because the back side of it is up against the tooth. Whereas if I were to go to the lingual side, the backside is no longer up against the tooth. It is pointing away, out towards the middle of the mouth. And so when we insert it, we want to insert it like a probe, and we just want to do tapping motions to get any calculus that may be heavier off. And then we can do some sweeping motions as well, some oblique strokes. And then you would want to do the same thing for any of the lingual surfaces that this would work on, which would be over in the lower left. You can do the linguals. You will insert it like a probe again, and then do some tapping motions, and then some sweeping. And then if you want to go and do the transverse stroke, basically whichever insert tip you're using for the side you're on. So if I'm using the right insert Cavitron tip for the buckle of the lower right, I'm not going to use this one for the transverse stroke. You want to think of it as when you're going in for a transverse stroke, you want the curvature of it to be facing up. So obviously it's not going to be this one, because if it was to face up, the handle would be in their throat, and that's not going to work. So you would switch instrument tips, and now we have this, the curvature is curving down and points up. This way we're going to be able to really get into the interdental space, and we can kind of slide in and out. We can do light tapping motions as we're going over to the interdental area. And this is going to help to get any of that calculus that's stuck in the caul area. And again, you can do the same thing. So for this one, since I can do it on the buccal surfaces or the buccal sides, I can do it on the lingual side of the lower left. I would just go in and out, and if I need to tap, I can tap. And then obviously all the opposite sides. So for the linguals of the lower right, we're going to use our right Cavitron tip. For the buckles of the lower left, we would use our right Cavitron tip, and that is the same kind of idea on the maxilla. It is important to also notice when you're. And then last thing that's good to know is, I'm going to grab my other tip because I'm going to stay on this side. So this is my right Cavitron insert, and since I'm working on the lower right on the buccal surface, it's good to know that the reason we want it to curve, the reason we want the back of it to be against the tooth, is because it's going to help to slide into those furcation areas and the roots of the teeth. I thought I felt one of these try to come out earlier, but anyway, when you slide it in, you've got this furcation area here, and the way that this is curved will help to get in those areas, so you can clean that as well.